Well, hello everyone, and thank you for joining us today. We're the Healthcare System Transformation Project team under the Rhode Island Commission on the Deaf and Hard of Hearing. Before we begin, I'd like to make introductions. My name is Christine West, and I'm the project manager for the HSTP grant. Next, I'd like to turn it over to Thomas to introduce himself.
Hello, everyone. My name is Thomas
Darden.
Darden, D-A-R-D-E-N. Okay. And I'm basically the coordinator and helping out and assisting with the HSTP program.
Thank you, Thomas. Alex?
Hi, everyone. My name is Alex LaFerrier, and I am the outreach coordinator for the HSTP project.
Thanks, Alex. We also have another team member, and that's Lindsay Conway. She's our communications coordinator. She's unable to join us today, but I hope folks will look forward to meeting her and welcoming her as a part of the team. I'd like to begin today first by acknowledging Pamela Zellner, who is the program manager at RICDHH. I want to recognize her efforts for planning and coordinating this Zoomcast for everyone today on behalf of Hearing Loss Awareness Month. So thank you, Pam, for all of your work. Appreciate it. So I'd like to give a brief overview of the project. But before I do that, I'd like to give a little bit of background about myself so folks can get to know me a little bit more, my qualifications, and also why it is that I came to HSTP. I've been an interpreter by profession for the past 20 years working in Rhode Island. I have a bachelor's degree from New York University in Deaf Studies. I also have a master's degree in Deaf Education from San Diego State University. And I'm currently working on a second master's degree at St. Catherine University. And I'm studying interpreting studies and communication equity. So I've approached this project from that lens, from a frame of social justice and also communication equity and the importance of that within the healthcare system. I've also had a lot of experience working within the Rhode Island Commission on the Deaf and Hard of Hearing, and so I'm familiar with the staff and also state government. And so it's a pleasure and it's an honor and it's a privilege to be serving in this capacity on behalf of this grant under RICDHH. So just a brief overview of the project. Again, HSTP is the Healthcare System Transformation Project. And this is a $646,000 grant that the Commission is responsible for developing and implementing. The grant basically has three goals. The first is data collection, and that includes establishing baseline and current findings of health data within the state and also nationwide. That also includes the development and implementation of two different surveys. One survey for the deaf and hard of hearing and deafblind communities to assess health outcomes, barriers to care, and health equity issues. There's another survey that we're responsible for developing and implementing, and that is for healthcare professionals. So that would include doctors, nurses, other healthcare workers, to assess their understanding of working with the deaf and hard of hearing community, as well as their knowledge of deaf culture, and also their understanding of providing access and communication equity to the deaf, hard of hearing, and deafblind communities. Once all this data is collected, everything will be gathered in a consolidated report that will be published and will be available to the community. And it's certainly our hope that the information that's gathered within that document can help to inform future health policy programs and services for the state. The second goal for the grant is presentations, workshops, and trainings for healthcare professionals. And there are several accountable entities which basically are hospital corporations. And as we know, that includes Care New England, it includes Lifespan, it includes various physician associations and groups. basically every hospital system or community health center within the state of Rhode Island. And so a big part of our efforts, and certainly amongst our outreach coordinator, will be providing training and education to those various stakeholders. And so we have certain targets that we have to meet by providing those workshops and training sessions. We look forward to doing that. The final goal is to develop and implement an interpreter training program within the state. And this is in response to the community wanting to have some kind of workforce pipeline available to cultivate more interpreters. As we know, we have a shortage of interpreters within the state, and this has been a huge issue for many years. We haven't had the opportunity to have any funding available to create something of that sort. And so this grant has given us the opportunity to be able to do that. We are working in collaboration with Rhode Island College, and the principal investigator and lead faculty member for that part of the project is Dr. Marie Lynch. And so we will be collaborating over the next year to implement that program. And as you know, that can be quite a feat to establish an interpreter training program. There's a lot that goes into that. I do want to mention that the grant runs from January of 2020 to December 31st of 2020. So the time frame is somewhat abbreviated. However, we do have the option to spend down the funds from the grant to the end of 2023. So any of our work that is not concluded by the end of the year, and if there is still funding that is available beyond December 2020, we have the option to spend down over a couple more years after that. So that's a brief overview of the grant. There's certainly more details that are involved in that, but I'll spare you that for now. And I'd like to turn it over to Thomas to share a little bit more about who you are, your background, why you came to this project, and to share a little bit about your role within it. Thomas?
Yes, the reason why I joined this project was because I felt that, as a deaf individual who uses sign language and uses interpretive services, I personally have experienced many of the frustrations and barriers that people speak of. And so I feel that this is an opportunity to make a contribution to this program, to oversee something and to see how I, in my own capacity, give support, to make changes that are well needed, and how we can provide better access to the deaf community in terms of interpreters, and so they can access their healthcare, not only for the interpreters per se, but also about health education as well in the deaf community in general. There are many factors, that impact the deaf community when we talk about healthcare and healthcare, how they receive their healthcare services. My role within this project would to provide support, make sure that the project is, moving along steadily. And I'm not sure if you want me to add anything else, Christine. Would you like for me to add something else?
No, I think you described that perfectly. Thomas, I think you're also playing a huge role in finance and operations, ensuring that staff operations are running smoothly, any kind of HR issues that come up, budget and budget forecasting, ensuring that we're spending within our means. And certainly your perspective is a valuable one, absolutely. And we're so lucky to have you on the team. So thanks for being a part of it.
Thank you, Christine.
Right, Alex?
Thanks, Christine. I just wanted to reintroduce myself again, give my background. So I originally am from Massachusetts, but moved to Rhode Island in 2013. My undergraduate degree was in interactive media and game design, but coming here to Rhode Island, I have recently accomplished my master's degree in public affairs, which focuses on policy development and analysis. And maybe you're wondering, well, a background in media and government and policy work, how these things seem unrelated. But in fact, I think the outreach coordinator position that I serve in is the perfect example of how these two degrees can be used in synergy with one another. We're in a heavy media saturated world, and getting a strong message across, especially when it relates to government policy, is very critical. And this is where I think I can serve in my capacity as outreach coordinator to build momentum around this project, to have community involvement, and more so to collect stories and data from the people in Rhode Island, the deaf and hard of hearing community in Rhode Island, to further impact services from healthcare providers to educators to even the public as well. So I think having a critical lens on that is vital. So I'm looking forward to utilizing my skills, both behind the scenes and front of the scenes, as we move into the second to third part, as Christine illustrated, the workshops, which will be put together by our team, myself, and we would like to spotlight speakers and physicians, both deaf and hearing, and giving perspectives to both communities, both deaf and hearing, because they each have their own unique needs and they each have their own unique understanding. So my background specifically with media and policy development is important, but also just my day-to-day involvement with the deaf community here in Rhode Island has also been very informative and comes from my heart as well. So that's something I'm looking forward to with this project.
Thank you, Alex. And I also want to comment that we're so lucky to have someone with your expertise in video, because especially now in COVID-19 times, we're relying so heavily on video, and we need to find alternative ways to be able to engage the community. And we're so lucky to have someone with those skills. And in thinking about workshops and trainings, going forward, especially during these times, trying to be innovative in sharing information about health professionals and how they can develop better patient-provider relationships with the deaf, hard of hearing, and deafblind community. It requires creative solutions. And I know typically we think of workshops and presentations and trainings as in-person 2-hour sessions. And oftentimes what we notice historically is that those sessions are not archived, and they exist in these very brief moments. And with staff turnover, oftentimes the information isn't retained. And so we start back at square one. And with Alex's expertise in video and editing and everything that he brings to this position, we can now start to look at more innovative ways to provide that training, such as we know that healthcare professionals that are working in hospitals in other settings are required to do mandatory trainings online. They have learning platforms that they're required to log on to, and there are mandatory trainings done via video within those learning platforms. And those are required for CEUs, continuing education units. Those are required for ongoing maintenance of certification. And so there's an opportunity for us to be able to take that expertise and translate that into learning modules that could be a part of this larger learning platform for healthcare professionals. So there's so many amazing ideas that can result from your expertise and everything that you have to offer. And so I'm just thrilled. I'm thrilled that we have a team with so many different skills and abilities, and definitely the heart that comes with serving on this team and in these positions. So thank you. Is there anything else that folks would like to say? I do want to let the community know that we do need your involvement, and we're asking for your involvement. Certainly when the Deaf and Hard of Hearing survey is ready, we'll be enlisting your participation. It is necessary and it is critical. And so we hope that you will participate in that survey, because it will provide us with vital health information that hasn't currently or previously been collected, and that can help to inform future services and programs moving forward. So we'll be able to share more information about that as we go forward. Also, we have social media outlets that are active. Lindsay Conway, who's our communications coordinator, is responsible for those social media platforms, and so she will be reaching out, and I hope you'll follow us on all those different channels. You can also reach out to us via email, and we will be sharing all that information with you at the conclusion of this Zoomcast. So Alex, Thomas, was there anything else you wanted to add before we close for today?
I believe you covered everything, Christine.
Okay, great, great. Okay, so Alex, yes.
Just reemphasize, like, we're going to be around in the near future. This is directly to the community. Reach out. There are many different ways we're thinking about in person and online. So definitely tell your friends, and your health, your involvement is one of our words, our phrases that we've been utilizing. So I would definitely emphasize that across the gamut of people. So look forward to it.
Great. All right. That's a great way to end. So thank you for joining us today, and we look forward to seeing where all this leads. Thanks so much for watching today.